The huge baby boomer generation, 78 million strong, is surging toward retirement age. For many, it will mean enjoying the fruits of labor in the autumn years of life. But others will not be as fortunate, which raises a key question: who's going to look after our nation's elderly in need of ongoing care?
With the advancements of medications and medical issues and health awareness, people are living longer lives. In 1980, the U.S. Census Bureau estimated or recorded 2 million people over the age of 85 in the U.S. They are projecting in 2040 that 9 million people will be over the age of 85. So the challenge is not only caring for that amount of people, but also the disease processes in the elderly that we are unfamiliar with at this time.
Experts predict there will be a demand for nearly 1 million more caregivers in the next decade and nearly 3 million more by the year 2030, as this role takes on utmost importance for the health and well-being of our nation's elderly.
They're going to need a lot more assistance. As they get older, they're going to need people who can be advocates for them, people who can be out there to continually assess what their needs are and adapt their care accordingly.
At caregiving facilities like Lutheran Care in Clinton, New York, a continuum of personal-centered care has been evolving since 1919. Here at its campus in upstate New York, services and programs are being geared to keep people independent and living at home for as long as possible, offering a healthy living alternative when they become disabled or unable to care for themselves.
Those of us at Lutheran Care believe that we have been given a duty and a privilege to create a respectful, safe, comfortable, and nurturing place for those in our care where they will be regarded with dignity and sustained in their faith and hope.
For instance, elderly people recuperating from a hospital stay will only need the service of a caregiver for a short time. The short-term rehabilitative program at Lutheran Care offers a dedicated unit staffed by highly skilled professionals, providing such needs as physical, occupational, speech, and recreational therapies, wound care, and IV antibiotics, until the patient is ready to return home.
Well, short-term rehab is important because it offers the opportunity for a person to be able to gain more independence, strength, function before they go home, because they're not staying in the hospital as long as they used to. And sometimes they're not even capable of going home right after discharge, so they need that extra step, not only for themselves or for other caregivers that might be home with them, family members, and gives them more confidence.
Non-residents can also benefit from the services of a caregiving facility like Lutheran Care. Its Active Day Seniors program offers a variety of social activities, personal enrichment programs, and caring attention designed to keep a person active and healthy so they can remain at home for as long as possible.
Active Day is a very active program. We provide socialization, cognitive stimulation, physical functioning. We feel it's important to treat the whole individual. There's a big base where they can really meet people and integrate and meet somebody that they have a lot of likeness to and similarities, and can socialize and really enjoy themselves for the day.
Because the work that's done makes people happy, it makes the families happy, it makes the residents feel that they have a life still to live. It's not the termination of their life, it's just life going on with another chapter.
As seniors' medical needs become more complex, however, multiple levels of care, including independent living apartments and progressive nursing care, may be a better choice than receiving in-home care. The key is providing a stable, home-like environment that allows each senior to maintain the highest possible level of independence and quality of care.
Here at Lutheran Care, we have a lovely campus-like setting that offers many different levels of care, from independent apartment living to supportive adult home living to our skilled nursing facilities. So we are able to offer compassionate care for those persons in need.
Technology has also taken a key role in caregiving today. For instance, an electronic system that allows paperless medical monitoring of patients. By means of a simple touch of the screen, a caregiver can review all aspects of a resident's care, from diet restrictions and meal schedules to physical visits and medications. And for those living with Alzheimer's, an innovative sensory room enables a resident to be more cognitively aware and better able to interact positively with others.
A lot of them have forgotten what Christmas is all about, what birthdays are about, what even just smelling familiar scents such as apple pie is all about. So this room kind of brings together familiarities of their past and allows them to remember things that were pleasant experiences to them.
Today's seniors deserve the best. Caregiving facilities like Lutheran Care realize the importance of respecting and preserving the dignity of the human spirit throughout a person's lifetime, so that their later years are spent in a caring environment. As our society ages and our life expectancy increases substantially, the need for caregiving has never been greater.
Our philosophy at Lutheran Care is to create a respectful, safe, comfortable, and nurturing place for those in our care, where they will be regarded with dignity and sustained in their faith and hope.
From a Victorian farmhouse in 1919 with a dedicated stewardship of supporting congregations, the scope of programs and services offered at Lutheran Care has expanded to where it now encompasses 5 facilities serving more than 500 people in need of compassionate care every day.
For nearly 100 years, Lutheran Care has been providing and developing and are still developing services for persons in our community who are in need of compassionate care.
Lutheran Care believes that a spiritual component, which is often overlooked in purely medical settings, is necessary to care for the whole person. This is provided on campus in a way that respects all faiths.
All of us have developed what I call spiritual resilience. The things that help us to do more than simply survive. And for many people, religion offers comfort and guidance and support through these times of change and difficulties.
Offering short-term rehabilitative programs, active day senior programs, and community services for non-residents, and multiple levels of care for those unable to live on their own, Lutheran Care provides a stable, home-like environment that enables each person to live fully and enjoy life. For more information on Lutheran Care, call 800-925-8115 or visit them on the web at lutherancare.org.